Hi, What the Health Chat listeners. I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care. This week, I'm talking to Simon Qasir, Head of Sales at Radar Healthcare. Simon joined Radar Healthcare in 2021 to help us work with and make a difference to more organisations across health and social care. Simon, do you want to tell our listeners a little bit more about you outside of work?
Yeah, of course. I have a keen interest in cooking. I love to cook.
Lovely.
I like cooking. I love to travel. I've been to lots of different places this year post-pandemic. Went to Madrid for a wedding, which was fabulous.
I love Madrid.
And
especially if you like to cook as well.
Yeah, exactly. There's some great places to eat out there. Went to Stockholm. That was really interesting. That was quite a city I'd never been before. Been to Tallinn at the beginning of the year.
Oh, wow.
Where it was super cold, but it was really, really pretty, really lovely little city.
Yeah.
So, yeah, I've been lots of different places. I love to cook, love to travel, got a keen interest in watching football, which is sometimes good, sometimes not so good.
Well, it depends on which team do you support.
I support Liverpool. So, yeah. So sometimes it's good, sometimes we blow hot and cold.
Yeah.
But it's one of the first loves I ever had, which was supporting Liverpool. So that remains. So, yeah, family, the usual stuff.
Well, as a Newcastle United fan, then I can definitely see the ups and downs. Luckily, we're on and up at the moment, but who knows?
Yeah, absolutely.
So, Simon, thank you for joining us today. It's great to have you with us. We're going to talk a little bit about your background in care. So, obviously, now you work with Radar Healthcare, but I understand your family's got a background in care homes, worked in them for sort of more than 10 years, and you actually owned one. So can you tell our listeners a little bit more about that?
Yeah, of course, yeah. So this stems back, I'm going to show my age now, but this stems back from the mid-80s. My parents purchased a few care homes, started operating care homes whilst me and my siblings were still in school.
Oh, wow.
So we grew up around that surrounding. So really, it was embedded in our formative years, the value of taking care of people, taking care of the most vulnerable in society. In our case, that was elderly. But yeah, it was a real great foundation of understanding what care meant. And that then subsequent to that, I think I was 20 years old. I moved here to West Yorkshire actually and bought a care home. I became the youngest registered care manager at the age of 21. Managed and ran that care home for a number of years. So understanding care and specifically social care was something that was instilled in us from an early age.
Yeah, and what an amazing thing to kind of instill in you from an early age as well, to kind of those values and, kindness and care. They're things that are so important in so many different elements of life as well.
Couldn't agree more. I've got an elderly mother at the moment who is, her memory's fading and having empathy around how these things affect the older generation is something that, I learned all those years ago and able to put that into practice even today is really, really useful. I think it was a really great life skill.
Yeah, no, absolutely. So what was your favourite part about working in the care home when you were back there?
I think that there's two parts to that, and that is a favourite part. I mean, listen, it's not an easy job. Running and operating a care home is not an easy thing to do. We, as Radar, our solution is offered to lots and lots of different care operators up and down the country that have some really, really difficult challenges, particularly now. But the favourite part is always, look, you're serving somebody, you're providing care, security, safety, and that in itself is such a wonderful thing to be able to offer, and seeing residents flourish because of the care that you deliver is such a rewarding thing when their relatives or them as individuals feed back to you and say what an amazing job that you're doing. And then the second part is the people that you employ and the people that, are responsible for that care delivery. It's so heartwarming, especially people that have not been in the care sector before, or young people that may be their first, second job that are coming into care, and for them to really understand exactly what that means and the impact that that's creating to the people that you look after. That's a really powerful thing to be able to offer that.
I think that's really nice as well. Like you said, it's not just about the resident themselves, it's the families. It's understanding, if my mum or dad were in a home or, my grandparents or something, it's, you want to know that they're being looked after, you want to feel comfortable. And I think to kind of have that feedback from the families, as well as giving that quality of life to your residents, they sort of go hand in hand, don't they?
They definitely do, Justine. And it's also it's something that I think, as creatures, as human beings, I think we care for one another.
Yeah.
And for that to be, part of your profession is, for me anyway, it was a really, really impactful experience that still remains with me to this day. And in many ways, I carry that experience through even into my current role as well, because understanding and having that empathy for what our customers go through is a really, really powerful thing to be able to, when we're offering our digital solution through Radar Healthcare, for us to even understand the human factor, it's really important.
Yeah, definitely. And I think that brings me really nicely onto my next question about, what did bring you to the dark side, if you like? What brought you from sort of the care home side onto the supplier side?
Yeah, it's a good question. I guess I wouldn't necessarily call it the dark side, but it brought us. I think it came full circle because I'd been involved in care for such a long period of time, and then coming out of care, and then and coming and learning what technology was having a role to play in the care sector. Look, care historically is not an early adopter of technology. I think that's fair to say. But 10 or 15 years ago, when I got involved in health tech, and originally I worked for an organisation where we were providing a learning and development solution for care staff. It was a real impactful thing to be able to provide a service or a product that was going to affect so many people, and especially as those people were involved in the care industry. And then subsequent to the learning development company, I moved on to a company that were providing a workforce development solution around staffing and rostering. And that too, to make sure that people get to the right place at the right time, and for those individuals to get paid on time through, a timesheet, was a really, really impactful thing to be a part of. And then more recently now with Radar Healthcare, we provide a quality assurance platform that makes the compliance of an organisation, which is so important in the way that it's graded, the way that the CQC or the inspectorate might grade a home, is really, really important that they have digitised platform, a digitised system that's able for them to be able to evidence base how they are improving on their quality. So health tech and technology, it plays such a massive role in our care delivery.
So I think that, that's really important. And I think, from our partners' side as well, how can our partners benefit, I guess, from your experience in both sides of your knowledge?
So quite often my role at Radar Healthcare involves speaking to people primarily at a more senior level, and to have that empathy about what a care operator goes through and the challenges that they're facing. It plays a big role into how I'm able to connect. And we at Radar Healthcare, even though we're a technology provider, we're very much a people business.
Absolutely.
So it's really important that we have empathy for the people that we're connecting with, and for my experience to play or to have a role in that ability to empathize is pretty important. And of course you can learn that, but because it's lived experience, it's probably obvious to the people that I communicate with that I've been not necessarily in their shoes, but I understand what they're going through.
I think that's it, isn't it? You've mentioned that we're a very people business. It's, that partnership approach is so important. We've talked about it in so many of the podcasts already because it does underpin so much of everything we do. And I think that, like you said, that lived experience, it does put it in a completely different context for someone who is trying to explain maybe some of the challenges that they are facing.
Yeah, I mean, the partnership approach is a real thing, and I think it's quite often, a very easy thing just to gloss over, and we use it almost like as a marketing speak, but from top to bottom, right from Paul, our CEO, all the way to our younger members of our sales team, everybody has bought into this idea that Radar is more than just a technology solution. It's how we deliver on the solutions that we're offering, but also what the impact that solution offers is carried out through the people that deliver it, and those people are real people. They're the Radar people. So it's not just a word. It's not just a marketing ploy of us creating this terminology partnership approach. It is a real thing.
Yeah, and I think you've kind of touched on this a little bit already. But what can sort of partners and other people and people within social care benefit from with working with a tech organisation like ourselves?
I think the first and formative thing, quite often people turn to us because they have a particular need or a particular requirement that needs serving. But what tends to happen is when we engage, particularly with my sales team, it's about understanding what their challenge is, and their challenge may well be that they need a new incident reporting or a risk management platform. But actually, through that conversation and through that dialogue, they understand that actually with Radar there is something more to be gained from this, because it's our ability to portray what is best practice around that particular subject matter. And it might be, for example, an organization wants to build a new quality assurance framework, and how best to instill audits, because they're doing hundreds of audits at the moment, but how do they get the most out of that particular business process? Because everybody recognizes that we have to do that. They know they have to do it, but how to do it. And I think that we're in a fortunate position as a technology provider, because we speak to so many different organizations, and the real breadth of the experience that we have at Radar Healthcare spans right across the gamut of health and social care. So some tech providers, for example, may offer a solution that is exclusive to residential care operators, or another one may be towards domiciliary care. With Radar Healthcare, it spans right across from healthcare all the way to social care and everything in between. So it might be NHS trusts in a hospital, it might be in a private medical clinic, it could be in a dentist surgery, it could be in a ambulatory or patient service. So that lived experience that we have at Radar Healthcare allows us to impart that to somebody and to be relevant to somebody. So it's something that a dental surgery might have adopted, a particular process that a care operator, a residential care operator, could utilize. And it's our people that are able to provide that breadth of knowledge and that breadth of experience.
I think that's the thing as well, isn't it? We work with lots of different organisations, but they vary in sizes as well. And I think that's another really important point, because there's lots of things that some of the bigger multi-site care homes might do that we can actually help the smaller suppliers implement in just a slightly different way.
It's a good point.
But it's a nice way to share that knowledge and that best practice that maybe they don't have as much resource to put into it, but actually there are ways that every organisation can learn.
That's exactly right. I mean, when my parents started operating care homes back in the mid '80s, they had one home, and then they bought another home, and then they bought another home, and they slowly built up this this little network of care homes. In that, it was in Hertfordshire, and at those times that's how the care sector worked. Much later, much bigger groups with a lot more money came into that market and swallowed up a lot of these smaller care homes, and over the years that's almost come full circle. That you still need to be of a certain size in order for these care homes to operate and be profitable, but it also means that they are able to learn from the experiences of so they're trying to run care homes as a place that people can find safe, secure, that they're able to call it their home. Mm-hmm. And I think that that's really key and really important within the industry, that we retain that.
That's a really nice point as well. I think people forget it's their home. They're called care homes, but I don't think people always associate those two things.
Yeah, it's true.
But yeah, I think that's such an important point. So we know there's some big challenges at the moment in the social care world, particularly with recruitment, staff turnover. We know that there's some areas of the country that are seeing up to 40% of vacancies that are not being filled. So how do you think we can support with that, and kind of any sort of answers from your experience?
Yeah, I mean, look, that it's a well documented problem that being a care worker is a really undervalued, thankless task. When you consider that a person who stacks shelves in a supermarket gets paid more money than the people or that work in a care home, it kind of says something about our society, doesn't it? And the value that we place upon on looking after our vulnerable. But so it is a massive problem, and it's a massive issue. It's a massive issue for a small care operator all the way to the really large, care operators with hundreds of care homes. And yes, you're right, Justine, that, in some parts of the country, there are 40% vacancies in care homes. And your question of how can Radar and our software help that? Well, look, there's a really, succinct answer to that. And that is that what Radar is really strong at is providing a solution that minimizes the amount of effort and work, effort and man hours that are taken, where historically a lot of the tick boxing or the compliance elements that a care operator needed to do would absorb a huge amount of time and take people away from their core function, which was obviously taking care and looking after the residents. So I think that the first answer is that with Radar Healthcare, the software that we provide gives the opportunity of really giving some of those man hours back. The second point that we're making here is around the vacancies that there are. And I don't think we have, as Radar Healthcare, a magic wand that's going to fix that particular problem. I think that's a really, really big problem, which, many successive governments have not been able to find a solution towards. What I would say, though, from a Radar perspective, is that what we're seeing is that care homes and care operators that have been using Radar, the familiarity of that understanding of that piece of software, and that when people do move from one organization to the other, and when they can bring that knowledge and experience to the next one, that seems to carry some value. So I think from our perspective, I'm not sure we have a magic wand that could fix the vacancy problem, but certainly from the perspective of giving something back in terms of the efficiency of time, effort, etc., I think Radar has a huge role to play in that.
Yeah, I think it's really important that as well. I went at the Future of Care conference recently, and they were talking about, obviously, this being one of the big issues, of course, and a lot of people were sort of saying, social care workers are seen as unskilled workers and low-skilled workers, and it's just mind-blowing that people view the role as that, because actually it's not at all. It takes somebody really special to do the job they do. Yes, it's hard work, but it's so rewarding as well. My granddad was in hospital recently, and watching the care that he got was amazing. And then watching sort of our family members come in and try and almost do similar things they couldn't do it.
No.
So I think it's people don't see it as a skilled profession, but actually it's an incredibly skilled profession. Yeah, I
really value this platform that you're giving today to suggest that it's a job of tremendous value, and I think that is something that is quite often overlooked. So your point is well made. Yeah,
I think obviously we've got the issues in recruitment and that kind of thing is extremely challenging. I guess everybody, there's such a focus on providing high quality care now, which is an amazing thing. Of course, everybody wants to provide the highest quality of care they possibly can, and it's there at the forefront. So I guess obviously with the cost of living crisis, with everything else that's happening at the moment, how can providers still continue to try and provide that high quality of care whilst obviously being in a little bit more of a crisis than we have been over the last 10 years or so?
Yeah, it's a massive issue, isn't it? It's a massive issue for everybody. Every single person in our country is facing a challenge right now, whether it's, how much heating you use during the day, or how, the cost of even going to the supermarket, or putting fuel in your car. Everything is going up, and that's no different to the care operators in the United Kingdom. I'm sure there are care operators that are thinking of ways to tighten their belts right across the country. Yeah, and I'm sure want as much as possible to retain the high delivery of care. And how do you do that? It's really, really challenging. I think that people are having to make some really tough decisions right now, whether or not it's, the items that they put on the menu in care homes, or the amount of heating that they have. This type of dilemma, I think, up and down the country, everybody is probably facing. I think from our perspective, from Radar's perspective, we're seeing that more and more organisations that are switching to a model where technology plays a bigger and a more productive role. That there are some cost savings to be made there, particularly around, as I mentioned in my previous point, around the man hours spent in certain processes. So one of the things that Radar is currently providing a real initiative for is a integration between a care planning software and our compliance platform. And this is going to take away the double entry that would be necessary when an incident is recorded in a care plan that is automatically updated into the Radar platform. Now, historically, that would have been two separate people, or it might have been the same person, but would have taken two amounts of effort. Even that simple thing of integration between those two platforms, which, by the way, I think is a real game changer for our industry, because for the first time, we're connecting a Radar platform with a care planning piece of software, which is going to mean that care workers up and down the country that are using that particular product are going to be able to record an incident in the care planning software, which automatically updates and starts the actions in Radar. And once the actions have been recorded and managed, then that information would be pushed back into the care planning software to say that the issue has been dealt with or completed, etc. It's a real difference. It's a real definer from. So what sounds a very simple process is taking away so many headaches within that care facility. It's taking away the amount of man hours spent on doing a very, very simple process. But Radar has taken the initiative with the care planning software provider to provide a really, really good user experience for the end user, and in this case, it's a care worker.
Oh, that sounds really exciting. We'll look forward to maybe a future podcast on talking a little bit more about that.
Yeah, it's a real game changer, Justine.
I think going on to, obviously we've talked a lot about your background in care, kind of where you've come from. So let's talk a little bit more about what you do at Radar Healthcare. So we know you're head of sales. So can you talk to us a little bit more about the sales process and how easy it is if people wanted to procure our system?
Yeah, of course. So my role at Radar Healthcare, it splits between two very distinct things. One is around the offer, the way we offer our product, and the way that we're presenting it to our potential customers, and how that's delivered is delivered through various presentations and demonstrations of the system. And then the second part to it is around the management of my team, and our team has grown significantly since I took over, and it continues to grow. So the role itself is quite varied, and I really enjoy it. And it doesn't feel like work, which is always a good thing, isn't it? When a job doesn't feel like work, you're enjoying it.
Absolutely.
Yeah. So that's a nice thing. That's a really nice thing. The second part to the answer is we make it really simple for people to procure Radar. The software itself is we don't operate a user-based license. So the way that the product is purchased, we offer an organizational site license that allows for an organization of any size and scale to have a subscription license with Radar that's paid on an annual basis. So it's a subscription license model that we have, and they can pay us monthly or quarterly or annually, however we negotiate, and we make that really, really simple. We've got a product that we use that generates the quotation. It provides a web URL to the end customer. The customer then accesses the quotation online, and they can, once they've accepted it, they can see the terms and conditions and sign in that same environment. And once they've signed, we then take over that. At that point, we push that information across to finance, and then we start the implementation process. So it's a very, very succinct, very, very simple to follow, easy way to procure.
I mean, the fact that it's not a license basis as well is so important, because part of the uniqueness, I guess, about our product is for people to have oversight, for people to be able to access it. So by not limiting the number of people in an organisation that can get on it, you're giving people you're empowering people to be able to do their reporting, and you're not always relying on senior management or someone different. So again, it comes back to that sort of how you feel about doing your job and being able to do it well, and actually having the accountability and the empowerment to kind of follow that through as well. Absolutely.
You've got to give people the right tools. And if you give people the right tools and they're able to self-manage, then they'll be able to do things on their own autonomously. And that's what we try to do at our utmost through the Radar software.
So tell me a little bit more about your team, and if our partners call and they want to talk to someone, who do they talk to?
So the sales department is split into 4 sort of distinct areas. We have a sales outreach team, and they are predominantly calling people to explain what Radar has to offer, setting up demonstrations, setting up meetings, setting up presentations. So they're an outreach team, and then we have a team that specialises in the public sector, particularly the NHS. So those individuals are really well versed and knowledgeable around what happens in hospitals and in acute trusts. So that they have got a wealth of knowledge and experience about how to actually approach those individuals, present, and to demonstrate Radar's offering. And then the third team concentrates on private care, both healthcare and social care. Predominantly it's care homes, which still tends to be our most ideal customers that benefit from our solution. And then the fourth team is a bid management team. So when an organisation is bidding or tendering, I should say, then the bid team would then take over. So there's 4 distinct areas, and to speak to anyone in our team, everybody's always accessible. So depending what particular customer you are or potential customer you are, would determine which particular part of my team that you would speak to.
Yeah, I think you touched earlier on, you go through the sales process when we're talking about the procurement side, and then you start going through implementation. And I know we've done a few podcasts on implementation, right, and we've kind of talked to our customer success team. So I think it's great to kind of have a different take on it as well, almost the beginning.
It is. Quite often we are the first voice that a potential customer speaks to, and that may well be someone in my outreach team that they initially get engaged with, and then we move them along to a business development manager that may then have some broader experience on how to deliver a demonstration that's relevant to that particular customer or potential customer, and then based on that, then we would move them to either, if they're tendering, then our bid team, or if they're directly procuring from us, then we would send out a contract, and then it goes across to our finance team to set up the relevant account details. So that's how the process works from our sales team. So yes, you're right. Quite often we're the first point of contact.
Yeah, and it goes back to that partnership approach again, doesn't it? The whole of Radar Healthcare are all behind this partnership approach. So it's not, you're not talking to different people constantly. You've always still got the same points of contact and things like that, which I think is fantastic.
Absolutely.
So at the end of every episode, Simon, we ask everybody what their health tech moment is. So it's a bit of fun. We want to hear your weird and wonderful stories. I'm sure from spending so long in healthcare itself, you've got all sorts of stories. So have you got one that you'd like to share with our listeners?
That is such a good question. You're right, there are so many. But the one that springs to mind is... So many years ago, when I owned a care home in West Yorkshire, one of the trips that we took our residents on, we hired a minibus with a driver, and we took our residents to see the Blackpool illuminations, and there was around 10, 11 of residents and quite a number of members of staff that came along to this trip, and we ended up getting to Blackpool nice and early before it got dark, and one or two of these residents had not been to Blackpool for many years, and to see their faces and the enjoyment that they had by going on this trip, going to a place that they had long forgotten, was really special. And we ended up having fish and chips at Harry Ramsden's, and it just brought back so many memories for them, and it was a really special thing to do. It was so many years ago, it was around 15-20 years ago, but I still remember that. I remember the faces of the residents and the joy that it brought them, and it brought us all closer together somehow. It was a real special trip, really. I'll never forget it. It was absolutely amazing.
As someone who had two grandparents that absolutely loved going to Blackpool every single year, I can 100% imagine their faces. Yeah. My grandma and granddad used to always talk about Blackpool, and they used to love going to they never went to like the sort of standard cafes that you'd go to. They'd always find like one of the ones where like the truck drivers would go to or something like that, and they absolutely loved it. So I can 100% imagine how happy it made some of those residents, without a doubt.
Yeah.
Lovely story. And that is why I love this question, because you hear about so many lovely stories
it's a great
as well.
question.
So thank you very much for joining us this week, Simon. I'm sure it won't be the last podcast that we see you on.
Thank you so much for inviting me, Justine.
And thank you to everybody for listening. We'll see you next week with another new episode. Don't forget to rate and subscribe. And if you've got any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.